Hey there.
Hey.
Hello. I don't know where that came from.
Yeah.
Welcome back. I'm one of your hosts, Steph. This is another one of your hosts, Bob. And together we are Steph and Bob, and we are Between Two T.
Between Two T.
Welcome back, everyone. Today we're going to be talking about being effective versus being right. And another way to put this is you can be right or in a relationship. And I don't know how many of you guys or gals out there have heard this and have thought about this in your own personal lives versus your work lives, but it applies to both. And we're going to be talking about different scenarios in the office where it's okay to be right, but it's also okay to understand that, to put your own correctness aside and to see the big game here is to be effective. I'm going to jump in to clinical staff. And I know at our office, we have team meetings from time to time because sometimes the communication among anyone at the office breaks down and we can have issues that come up in our private practice. But this can apply to anyone's practice, work life, home life. And the trick here is it's not about just talking, it's about listening, which I'm going to pause there. You are doing an exceptional job listening right now.
It's one of the things I like to do the least.
I haven't seen any tears come out. You're not bleeding from the ears just yet.
I really love to talk, and I do not like to listen.
I'm right there with you, and it's tough because listening is so important if you are going to be effective. Part of being effective with your patients, say, is when you're presenting a treatment plan, you have no idea where they're at other than their body language, maybe some grimaces. Right. Some extroverted patients might even cut you off, halfway through your spiel. And then
and that's where, if I could interject, reading their body language is critical. And you're looking for facial expressions, knowing to hit the pause and say, does what I just said make sense to you? Do you have any questions about what I just said?
Before I leave a treatment room, I always ask, do you have any questions?
Really?
I really do. I ask the patient that, and then here's the trick. Then I turn to my staff member.
We're going to hear a trick, everybody.
Then I turn to my staff member, and I'm like, so-and-so, do you have any questions?
Really?
Yes, because that decreases the chance of a treatment plan, which they're responsible for, coming out incorrect.
That's impressive.
Especially a new staff member. Yeah. And it allows them an opportunity really quickly to say, no, I need help with codes, or I'm confused. And it actually is funny when they say that, because then the patient laughs and goes, me too.
Well, and what I like about what you just said is, and we all know this, we walk out of the room, first thing the patient does is look at the staff member for confirmation. The staff member is the ultimate confirmation person. So I really like that.
Yeah.
I'm going to try that.
I appreciate that. And it's nice because usually if my staff member is confused, the person who works with me every day, there's a good chance my patient is confused as well.
And trying to figure out, I like the questioning and figure out what's going to work for you, what's going to roll off your tongue, what's going to be easier. A lot of times patients actually like to hear their names. Everyone likes to hear their names.
And I'm going to pick up, and yes, names are huge. Names are very important.
You can say, if the patient's asking a question, being able to repeat that.
And even if you don't know how to say the patient's name, it's okay to be upfront and honest about that and say, how do you pronounce your name?
It's Mrs. Smith.
Funny thing is I'm always a, hey buddy, or how you doing, pal, kind of person. And I've had patients actually correct me, older patients at that, and say, no, it's Mr. So-and-so.
I always feel bad saying, hi, Jane, I'm Dr. McNeill.
Oh, I walk in just like, hey there, man, how are you doing? I'm Dr. Ganter. Nice to meet you. And that tends to be my jam, but I have been stopped in my tracks, dead cold for that with some people.
Knowing a teenager versus a 35-year-old versus an 80-year-old, this is the dynamic. Probably we're male versus female, older versus
There's really only one population that does that. I don't know if we're going to get into a demographic study here, but the other thing I wanted to touch on with body language is when you walk into your office, if you're going to be effective with your staff members, if one of them has something new done to their hair, or they're wearing something different, maybe they aren't peppy that day. instead of faulting them for being a little slower with things, or maybe they're not responding to you as well, maybe they don't say hi to you when you say good morning, it's your opportunity to ask them, hey, is everything going okay? Because if you do not have great communication with your staff, it could be anything. It could be a problem at home. It could be they're still upset from something you said yesterday that you weren't even aware of.
And that's what we try to talk to staff too. When we see patients, especially in a surgical practice, you're a periodontist, I'm an oral maxillofacial surgeon. Most people don't want to be there to see us. They're not really overly excited.
Oh, absolutely.
And we see people in a tricky spot. And so
and I kind of break the ice. The first thing I do when I walk in a room, and
you sing, don't you?
I do sing, but the second thing then I do is I say, you know what? This is I see, because you see fear. The minute a doctor walks in, there is sheer fear. Sometimes patients don't know if you're carrying in an anesthetic syringe in your back pocket.
Which you probably are, to be fair.
Perhaps, sometimes it gets that way. But my point is the way I break the ice is I just say, hey, this, I see, I don't say I see fear.
I see fear in your eyes.
I can smell the fear on your face.
I can smell the fear from a mile away.
So what I say is I'm like, look, honestly, this must be one of your worst days of the entire year today. And I can't tell you how many people say yes.
Empathy.
And the rest of the consult goes a lot better the minute they know that I know this is one of their worst days.
What I will normally do when I see someone so apprehensive, I'll quickly go into, I can see you're apprehensive, or my assistant told me that you're pretty nervous about all of this. That makes you normal. No one really comes in super excited. Let's talk about ways that I have to help make you comfortable. And
love it.
I usually tell a story. I have a patient, it's one of my favorite patients. She came in and she's telling me that, no, when you say speed it up, you got to do it down below so they can't see. It's like this. Well, we'll talk about my favorite.
I've got more points.
Yes. All right.
So
go
another
ahead.
point is not.
They'll never hear about my favorite patient.
That's okay. We'll do it in another episode. I promise you, it'll be Bob's favorite patient ever.
Oh.
Period.
Yeah.
Heart. Purple heart.
Yeah.
So the other thing, we've talked about being effective with your staff. We've talked about being effective with patients. What about being effective with colleagues? When we, one of the things we do as specialists is we coordinate treatment with other specialists, with general dentists, with other physicians sometimes. And just because you feel as though you have the right of it will not make you effective in coordinating care. So you want to give us some tips? You've been in practice a couple of years now. What have you learned about being effective with other doctors?
You have to have a great level of communication. And whether that's...
How do you establish that?
So having a connection, I like to send off my consultation note with all the details that we've taken in, with what the plan is. And at the bottom, I say, this is what I'm thinking. If I need a call back, hey, please give me a call about this. We have a bunch of docs that we work very closely through WhatsApp, which is great.
WhatsApp is fantastic.
WhatsApp to send clinical pictures, and don't laugh. That's
yo.
Yeah,
this is WhatsApp.
Yeah, WhatsApp.
No, I love it. And touch points. Talk about touch points. Does that make you effective?
I literally thought you said you were going to be talking for all of this, and now it's
let me talk about touch points
and not being afraid to reach out to somebody, but finding an effective way.
So the reason I want you to go there first, and as we kind of wrap up on being effective with referrals, a younger doc trying to connect and communicate with a doc that's more experienced is a challenge, and we're going to delve into that in a different episode. But just needless to say, there are nuances to that. I cannot approach an experienced doc like you can approach an experienced doc. And I kind of thought you could. And I've definitely made some missteps in private practice because of that. And so it's just food for thought. We're going to delve into some of these topics on other podcasts. Don't worry, you will hear about Bob's favorite patient ever.
Eventually.
But
It was really a good story.
Oh, it's
Someday.
Okay. No worries. Someday. That's a little carrot.
If you want to hear it, please subscribe.
We're going to list his phone number in the comments.
please
give him a call for a good time.
put down a wow.
We need you to describe, put a comment in the box. Tell us what you want to hear more of. Thanks so much for tuning in, guys. I'm Steph.
I'm Bob.
And we are Between Two Teeth. Thanks, guys. Appreciate it.
For a good time.